We received funding from the NHS to work on a diabetes campaign with our community champions. They had specific diabetes training, and then they would go out and they would talk to people wherever they could about diabetes.
I personally went to Greenhead Park a few times just because it's nice weather, everybody's out and about.
We worked with around 40 organisations. We've got groups that work with asylum seekers, we have groups that specifically work with veterans or adults with autism.
We support autistic people. Autistic people, it's their thing to be forgetful, to eat healthy food, to go and see the doctor. Actually, they are quite often anxious about doing the health checkups. They quite often overindulge in food like sweets.
I'm from the African Caribbean community, and that community is right up there in terms of not being able to tackle prevention of diabetes very well. I thought, I've got to make a difference, because I had high blood pressure and I didn't know it, and if it wasn't for somebody telling me to go and get tested, I may not be here today.
We are doing Diabetes Awareness Week in at Al Center today, and I'm expecting the groups of people from South Asian community and predominantly from Indian background.
They check measurement and my weight, and they say I'm on high risk, so I have to regularly check my blood pressure and sugar at the doctor's surgery.
And I'm surprised that some of the people, they were not aware that what is available out there which could be sugar-free and the taste is the same. So hopefully we'll make some difference today.
In this community, it's a taboo subject that people don't discuss about, but it's one of the biggest causes of illnesses that takes place. And a lot of people were actually shocked how much sugar it actually contains in certain drinks. And simple things like this, the small pieces that they can change, can make an impact on the bigger picture.
As part of the diabetes project, we had funding for smaller groups to build in awareness and conversations as part of their day-to-day activity.
Every time when we meet, we remind our members how important a healthy lifestyle is. So there is always a hot soup, for example, made of the seasonal vegetables, which is cheap and easy to make. So that's our healthy choice and proposition for them. Sugar-free banana bread, for example, or sugar-free cookies. Then the yoga. It's all connected.
It's always really wonderful working with the smaller groups, because they come up with some wonderful ideas for getting those messages out there. And one of their ideas was to write a song with their members.
Yeah, let's write a song. Let's actually write a song about diabetes. And yes, so message is there. Change your life for the better. Add some stevia to your life.
The third part of the funding was to identify any areas in Kirklees where we felt there was a real need for that extra support, and then to get some peer support groups up and running.
So this group is a diabetes support group. It started off quite small actually. We only had a couple of people at the beginning, but the word's got out and we have a regular attendance now. It can be up to 19, 20 people. It's not clinically based in that it's not too formal. Most of the people here form friendships and they know each other, and it's very much led by the people that attend. Today we looked at snacks and how people deal with snacking basically, and healthy swaps. All the feedback I've had has been very positive. They've all said that they enjoy it, they like the informal aspect of it.
And the idea is that those groups will now keep on running, but with the actual attendees running them. During this campaign, the community champions had over 3,000 conversations with individuals. The campaigns only run for a few weeks at a time, so that is a lot of people to be getting those messages out to. In total, we have 91 community champions. They speak 19 community languages as well, which is just amazing for our reach. They are now producing an easy read booklet which will cover all things diabetes. It shows that the work that the community champions are doing, it really is making a difference, and it really is so important.